Welcome to Learning to Lead, a podcast about leadership, teamwork, and reimagining healthcare. This podcast is for learners, educators, and healthcare professionals interested in building leadership skills in a supportive community. We are your hosts,
Rahul Anand,
Maya Doyle,
Peter Longley,
and Brooklyn Weber. Together, we bring you conversations with emerging and established leaders, deep dives, and hacks to help you become the best leader you can be.
Today we're talking about leadership in healthcare through a lens many of us may not have thought about before, soccer. And for this, we're delighted to welcome the one and only Dr. Gonzalo Bearman, Chair of the Division of Infectious Diseases, Richard P. Wenzel Professor of Medicine, and Associate Chief Quality and Safety Officer for Research at Virginia Commonwealth University Health System. For Dr. Bearman, soccer is not just a sport he loves, it is a way of living and a way of thinking about leadership, teamwork, and how to help people work together towards a shared goal. So today, we'll explore what healthcare leaders can learn from the beautiful game and how lessons from the field can help us lead ourselves, our teams, and our systems more effectively. Gonzalo, welcome.
Thank you. You're very kind with your introduction. Huge honor to be here with you, Rahul, and the rest of your team.
So shall we get started?
Absolutely.
Gonzalo, can you take us into a moment either watching soccer or playing it or leading in healthcare when you realized, wait, soccer has something to teach us about leadership?
Well, I think that I spent, as you alluded to, most of my life and still playing competitive football or soccer. And as I transitioned to more of a leadership role as an infectious disease specialist, I realized how there's so many parallels between sport. It doesn't have to be soccer. It could be any team sport, really. And any other team endeavor, which requires a group of individuals with specialized skills working towards a common goal. So there's a lot of translation between those. And as we say with patient care, right, that a patient's story really is more impacting than labs and physical examinations. I think a sporting lens is much more impactful, in my opinion, and memorable than a dry discussion on kind of leadership principles and practices. So it's very much something that evolved over time, but it's been there my entire life, and I finally woke up to the idea.
So there's a team, there's a shared goal, and you're in a relaxed frame of mind, so the lessons sink in without them needing to be forced into you.
That's right. That's right.
And would it be fair to say that soccer is your favorite sport?
Without a doubt. Now, full disclosure, I'm born in Argentina, raised partly in Argentina and the USA, and I have 2 passports. So it's kind of in our DNA to be football or soccer fanatics.
That would be hard if Argentina is playing the USA, but thankfully that's not the situation here.
Well, I guess I would have 2 lottery tickets, then either way it would be okay in the end, right?
I like that framing. So what are the top lessons from soccer that can be useful for anyone in leading themselves or their teams or new initiatives?
I would focus on 3 messages. As you know, I published a paper talking about the top 10 things learned on soccer and leadership and healthcare infection prevention. But let's move out of that realm and just look at 3 things. Number 1, I think this is really important, is not only the importance of individual perseverance and grit, which you see that with individual athletes, but also the importance of a nurturing kind of environment and team dynamic that allows people to develop. So you take the example of Lionel Messi, I allude to him a lot, that yes, he's a tactical and technical genius. That's not in debate. And he became a full professional footballer at age 15 or so. But you don't get to the level where he is now at 39, that many years of playing at the top, without having obviously the skill and kind of the innate talent, but the environment that allows you to develop and continue to flourish. And the same holds with medicine. You get a lot of talented young doctors coming into academic medicine. And your goal is not necessarily to teach them always new clinical skills. Your goal is to teach them, how to flourish in the environment of academic medicine, what to do, what not to do. Give them a hand and let them fall when they need to fall, right? And they learn from those experiences. So lesson number 1 is it's not just the individual player, it's also the organization, whether it's the club, as you say, we say in football, or the division, the department, or the academic center that you're working for. That's number 1. Number 2, and I think this is really important, is for those that want to be leaders in sport, soccer and other sports, the best players don't always make the best coaches. So why do I say that? Because I've seen in academic centers, they'll elevate people to places or positions of leadership. Well, like this individual has a lot of grants, therefore he or she should be the division or department chair. Those are different skills. Those are completely different skills. So you have to develop the skills of leadership to be an effective leader. And just because you can run a lab or because you can run a clinic doesn't mean that you're going to be good at running a major division or a department. So those skills need to be to be developed. And to get to that leadership level and have the credibility, you have to have the entry level clinical skills or research skills to talk to your team, right? So although the manager may not have been the best footballer or soccer player, he or she probably played at a pretty decent level to understand the game. You have to have had that experience. And that holds for medicine. I'm a big believer that if you're the clinical chair of infectious disease, you better have some clinical credibility in addition to some academic credibility, scholarship, et cetera, et cetera. If you are not in the trenches seeing patients and don't really understand the day to day in the clinic or on the consult service, you're probably not going to be an effective lead. You have to be able to play or have played the game at a high level to lead at a high level. And then the third one, now this one took me a while to figure out, and this is absolutely a football parallel. A coach generally has 22 or 26 players at their disposal, right? With each with different skills, talents, positions. You know, some kick with the left, some kick with the right, some defend, some shoot better, some attack, some are goalkeepers. You have to learn how to play to people's strengths, and you choose your lineup or your people on the field and their roles based on their strengths. We frequently hear people say, well, you need to work on your weaknesses. I'm not saying you don't have to work on your weaknesses. That's really important. But I've learned that if you play to people's strengths and give them roles and opportunities that really honor their strengths and their passions, they generally do better. And the same goes with a football lineup. You're not going to put Messi in the back as a central defender. Not that he couldn't be a defender, but he is a number 10 up top, creating the chances and scoring the goals. So, lesson there is if you're a lead, division chair, department chair, and you're working to develop your team, you really have to make sure you understand the people as individuals. I'm not saying as doctors, just as individuals, as human beings, know their strengths and their weaknesses, assign to the best of your ability their work, their obligations, their clinical efforts, their clinical focus, academic focus to match their strengths. It does not mean you overlook their weaknesses. Where you can work on their weaknesses, I think that's still great. You want to work on your non-dominant leg in soccer or non-dominant foot so you can kick with both. But if you're naturally a left-footed kicker, you're going to be stronger with your left, obviously. But you got to be able to kick with your right, particularly if you're at a high level. So that's the analogy. It comes with the three things that come.
So I'm reflecting back the three lessons. One is balancing individual grit and resilience, which is a great lesson in itself, with the team's performance and goals. The second one is that just because someone's technically excellent doesn't mean that they're going to make a great leader. There's much more to it, and that needs to be intentionally developed and comes with experience and skill. And then the third is that in the role of the team leader, one has to be aware of and develop and use the individual player's strengths for the team to do best.
That's right. That's right. And you really have to know your people, your individuals to know their strengths and really care about.
Let's begin with the individual lesson, and I'm quoting this from your paper. This is from Megan Rapinoe, the 2019 FIFA World Cup champion from the USA, and her quote is, "It is hard to beat somebody that never gives up." And I would say for me, this has been the most important and enduring lesson from sport. I played a lot of cricket, and that helped me survive medical school. And every time that there was a moment in my life where things looked really hard, whether it was not matching between finishing medical school and getting into my medicine residency, or it was finding a job in the middle of New York City in the middle of the financial crisis, which took more than a year to find. This lesson from sport always came back to me that you just never give up. And I think the most memorable games are also the ones where our team or any team, if it's the underdog, comes from behind and surprises everyone. So that's an enduring lesson that has stayed with me and came out to me from your paper as well.
Nice. I think resilience is absolutely critical, perseverance. That doesn't mean that everything's going to be a positive or a win. You know, one of the things that I explored in my many readings on football managers or soccer coaches is that one famous coach, Guardiola, who's the coach of Manchester City, said is that if you do everything right, you have a perfect lineup, everyone plays great, your likelihood of winning the game is about 75% because there's so many things out there that you can't control, which is your opponent, the referee, luck, mistakes. People make mistakes. Even the best players make mistakes. So how is that relevant? So it's the perseverance that, yes, we did everything right. It didn't go our way, but we can come back to fight another day, and not giving up. And that's really important. That's really important. The same goes through academic medicine. People, oh, I submitted my paper to 3 journals, it's been rejected. Well, let's look at why and let's make some adjustments because I think there's some quality there and we'll find a home for this. You're not quite ready this year for promotion to associate professor, but in 12 months, you're going to be perfect. You're in. So let's wait. Let's beef up a couple of things that you're doing well and make sure that we get you to associate professor in a timely fashion with the right kind of support. And those are kind of lessons on perseverance. But the perseverance isn't just an individual thing, right? You have to have also a group environment that's nurturing and collaborate and has that dynamic that is positive. But the team dynamics have to be positive at all times. You're all moving forward, not always in big steps, maybe 2 steps forward, 1 step back, but you're always making forward progress. And people feel safe and they can talk to each other. Again, they sort out their day to day nuisances and their day to day kind of friction has to be sorted out amongst the team. That's really important.
Talk more about that because when I listen to your talk of leadership from a soccer enthusiast's perspective at the
Yeah.
National ID meeting, that really stayed with me how you are a great leader for your division because of the way that you honor the individual, take care of them, and make them work together as a team. So, talk about how you've applied these lessons to your own division.
Yeah. So thanks for the kind comments. I wouldn't go so far as say I'm a great leader, but I've had some success and we've been effective with various things. I guess you'll have to talk to my faculty members if you want the truth. I just got to get it from them. But I think the first step is you have to define what the team culture is. They call that the locker room culture. And I don't mean locker room in a jocular way. I mean locker room of the team. Like, what's the dynamics of the team? So we realized at VCU, I thought at least, that the university culture statement or mission statement or whatever you want to call it, I thought it was way too corporate and it didn't resonate with anyone. No one. So we came up with our own microculture. Now, why not define the culture of VCU infectious disease? I mean, we understand what the university wants. Let's define our own microculture. And we did this. We hashed it out over 1 or 2 meals, and then we came together with a statement. We all agreed on it. And we published that too. That's in a different paper. But the point is, that it's quite simple. The culture statement is the VCU Division of Infectious Disease strives for excellence in all matters of work. We don't say it's research versus clinical versus education. You strive to be the best you can while being collaborative, inclusive, keep taking care of each other, and striving for work-life integration. That's it. Those are the team rules. So those are the starting points. The team rules, by the way, we published, as I mentioned, but we also printed, framed, and they're on every floor in the clinic, on the wall. So that's like the house rules right there. So you got to play within those rules. That means that if something happens to one member of the team, it happens to all of us. We're there to help. Someone calls out sick with a sick child, no sweat. We got you covered. We got 5 consult services. If one is having a busy day, no problem. That carries over to the next service and so on and so on. If you're busy, we say we shouldn't be here later than 6 p.m. every day doing consults. Carry everything over to the next day and we pick up. If that next day it's your boss coming on service, no big deal. That's the way we do it. Pick it up. So it's got to be the team culture. And that's also allows for communication and dialogue. We should be able to speak with each other in a way that's collaborative and inclusive and respectful. And if someone has a disagreement, that's fine. We can disagree, but we should be able to talk about it.
I appreciate how you've guided this team to have a common culture and put in the hard work to A, honor actions and words in service of it, and B, make sure that people are not breaking that culture.
Well, again, we all agreed upon it, so it wasn't just me. The idea is if we all understand the team culture, the team locker room, so to speak, that we should all work together for the common purpose of the team while honoring our individual skills. That's the idea.
Pete, Maya, Brooke, let me bring you in. So, cards on the table, first of all. Are you soccer players? And if you are, what's your favorite position or another sport, if that's your favorite?
Not soccer, the other football. I played American football in high school.
Yeah.
But I was way too short, not too fast. So I probably would have been a pretty good hockey player. The thing that kept sticking with me, Gonzalo, is yes, culture is huge because I also ICU nurse and was in the army.
Mm.
So you have to have good chemistry to increase, right? You want to get to the mission, you want to increase the intensity. Everyone's got to be working from the same kind of understanding because, yeah, there's going to be total different interpretations of what the mission is and where you're headed and what you're doing and how to do it. And just trying to get that. I was a very good technician, but I went into management and I had to learn a whole different set of skills, which I was not good at, like communication, right? You can tell me what to do, I'll get it done. But communicating it to others, holding them
Yeah.
accountable and boundaries and all that fun stuff is where I struggle.
I like your comments, Pete. And by the way, American football or hockey or baseball, it's all the same team principle. Substitute a team sport for another. You talked about the team spirit and the teamwork. One of the things that I didn't mention, kind of in the top three, so if I may add the fourth, is that I think that we frequently look when we recruit individuals to the team, whether it's a nurse or a new doctor, look at their CV. Where did they go to medical school? If they're faculty members, how many papers have they published? How many accolades have they received? That's not necessarily wrong. But I think the single most important indicator, well, those are like entry level criteria. You have to be a good doctor, a good nurse, et cetera, et cetera. But the single most important indicator of someone who's going to thrive is, are they a team player? That's the most important thing. Because if you don't have a team player, that's going to result in like discord, divisiveness, and then you're going to lose control of the locker room as a manager or as a coach. And that's going to be a problem. Now, there's no easy way to sort out if someone's a team player or not, right? One red flag for those who are listening here. If they've changed jobs every 1 to 2 years, that's probably a red flag. Unless there's like a real situation like, well, my spouse needs to change jobs because of such and I have to follow. I mean, I get that. Okay, but changing jobs frequently is a concern. You know, number two, ask the questions. I probe about their philosophy on team players and see if I get cogent answers and if they can give me an example of where they've been team players. That's really important. And number three, and you may call this a nuclear option. I'm not sure how to best phrase it, but I've called a division chair or further people on the references and asked them, is this person a team player? Have you seen non-team player kind of activities? And if so, describe them to me. And I've actually had individuals tell me, they struggle with being team players. For me, that's disqualification.
I
You're disqualified.
completely echo that. It is easy to get someone in your team, especially when you're short staffed, but so hard to get rid of them, firstly. Second, when I have someone who's not a team player, I spend more time cleaning up after them than if I would have done the job myself.
Right.
So it's one of the most important jobs as a leader to find and nurture and reward team players. And secondly, to avoid the non-team players. And I appreciate your tips like, frequent job hopping, asking people who they've worked with. Those are some of the most helpful things. I
Any
think everything is learnable. That's why we believe in learning to lead, and even team skills are learnable. The intention has to be there, though. And there is a systemic effect because we reward everything in academic medicine and a lot of times in healthcare on the basis of individual
uh-huh.
accolades. Your first author, your corresponding author publications, sometimes in clinical side productivity. So, as leaders, we have to make sure that we take care of our team players and reward them appropriately for the work that they're doing.
Yeah, couldn't agree
Rahul,
more.
that's what I'm thinking about in terms of, yes, we're rewarding our team players, but also how do we help them learn to be team players? Because we're striving to be the best and do the things that we need to do individually or individually with our clients. But I'm not a soccer fan, although I have friends who are deep soccer fans, and we've been watching the games and having a grand time. We're really a baseball family in my house, and we were a little league family when my son was growing up.
Yeah.
And what I was thinking about today when we were, talking about sort of one of our sports stories, thinking about how when we had those young kids who were starting to play baseball, right? And my husband was coordinating and doing other coaching around our league, and thinking about how we helped the young people learn to be a team, right? And learn to rely on each other and learn to, pick on each other's kind of signals about what was going on,
Yeah.
right? So that those are skills you have to learn as well. And some humility that you have to learn too, right? Because we'd have superstar, even kids that were fantastic, and then some that were they're not so great. But we have to learn, right, to kind of balance that and not just like pay attention to the stars, but pay attention to everybody. And we've talked about followership here before, right? It's how do you become a team member? I don't
Right.
think that comes automatically.
No, it's not easy. And you remind me of a quote from a famous soccer manager from Spain, Vicente del Bosque. He coached Spain in the 2010 World Cup when they won the World Cup. And he also coached the famous Real Madrid football team for many years. And he had a great coach. He said that a day after a big match, I spend the next training session with all the players who did not play, not with the ones who started, not with the superstars, the ones who didn't get playing time, to remind them of their importance, to let them know their role in the team, to help them in their development, to keep them engaged. So the parallel as division leaders or medical leaders is, and within your teams is, obviously it's not a game. Some play and don't play, but you have to know or have to do those frequent check-ins with your team to understand how they're doing, how they feel they're being effective, what they would like changed, what they would like to do differently, and in many ways, and this is an important, it's an entire different topic, what they should stop doing so they can stay focused. That's kind of been one of my biggest jobs is telling people what not to do. Like I wouldn't do that. You're wasting your time to keep yourself engaged on the valuable things. So that's an entirely different discussion. But there's no easy recipe there. But what I would say is, if you lead, you have to be.
What I also appreciate about how you lead is that you bring your coach persona into leading. You're not just managing these people or directing them, but you're acting like a coach and trying to make sure that, their talents and their strengths and their wins are maximized along with the team's win. And that's great role modeling of the leader as a coach.
Oh, thank you. So, I mean, I see my success as a division chair as so people. I was just recently asked, like, what do you do as a division chair? Like, what is your job? And I said, it's real simple. It's really not at times, but it is really simple in principle. I have to recruit, engage, and retain people. Now, you recruit the best people. We talked about that, right? The team players. You keep them engaged, and they stick around. If they're engaged, they stick around. They generally do. People generally don't leave. And the proof we have is the very low turnover rate, exceedingly low. And my team continues to grow. And I'm not just talking about faculty. I'm talking about the people answering the phones. I'm talking about the nurse practitioners or the advanced practice providers, because it's more than just nurse practitioners. I'm talking about the research staff, et cetera, et cetera. So we want to keep them engaged, because if people feel engaged, pretty much everything else follows. They'll do the online training that they hate doing. They have to do, the stuff that drives you nuts at working at a major state university. They'll do that, not with a lot of enthusiasm, but they'll get it done. And those little nibblers of your time that drive you nuts will go away if they feel they're engaged with the things that are valuable to them. And what I've learned through the medical literature and some of the other business literature is you don't need to be engaged 100% of the time. If you're engaged about 20% of the time in things that you think are valuable, you generally feel pretty positive about your job. You put up with a lot of stuff. So it doesn't have to be, today's going to be great from start to finish. You just got to have one or two good hours.
So, Brooke, how's this landing for you as a student?
Yeah, I actually played soccer. That was the sport that I played growing up. I played in high school and I also played club up until I stopped around college. So I do love soccer as well. And I think so many great points have been made. I would definitely echo what Maya was saying earlier about how it's like your first exposure to like working in teams. Cause I think back to that time and how like that has definitely shaped how I am now was like playing soccer and like being a part of a team.
Mhm.
And then another great point that I'm thinking about that was made is that like the importance of every person on the team because I remember like games where our best player, like who like the best player is, and they could be having their best game, but if everyone else isn't, it doesn't really matter that that person is because the score in the end could be that we lost because everyone wasn't like showing up. So I think just so many like good points can be made from
Yeah.
soccer to leadership. Yeah.
There are a lot of cool points that if you watch Ted Lasso, I think there's a paper someone wrote on like Ted Lasso and like, life teaching moments or like leadership moments. And, one great quote that he has, you're talking about the team versus the individual, is when he's
Mhm.
talking to his famous star player Jamie was a bit brash and arrogant. He's like, Jamie, I know that you think you're like 1 in a million, but out there you're just 1 in 11, right? And if you can turn the me into us, sky's the limit for us. So the big change, think about not only your skills, but how it fits into the team dynamic.
Yeah, I love that.
I appreciate the Ted Lasso reference as well, just because of something you said earlier, Gonzalo, about sort of the messaging that you do, like the sort of rules for everyone on your team, like the things to remember. I
Yeah.
think that idea of like, how do we make sure that, not just, oh, we sit down and we write a mission statement and it disappears, but that it's public and that we're talking about it and that it's around us all the time, whatever team we happen to be part of. I just really like that idea and how we just constantly bring that across.
Yeah, I think when you're talking about team goals and ideals, you have to kind of touch base periodically. The frequency with which you do that, you'll have to decide. Could it be a quarterly meeting? Could it be a monthly meeting? We have that. And in our spaces, our conference room, that's where the framed team statement is. In the rounding team room, that's where it's framed also. It's in the clinic also. So we have a clinic team room, a rounding team room, and then 2 floors, and it's on both floors of the administrative office. So it's there.
I love that. Yeah, we are Ted Lasso fans here as well. I have a believe signed at the exit of my office door as well. And we need our Med Lasso in healthcare. So, Gonzalo, you're our embodiment of that.
I'm not sure about that, but I do like to talk about soccer. So, and I brought my Argentina soccer scarf. You can see that, my World Cup scarf.
We're cheering for Argentina.
Thank you.
Gonzalo, thank you so much for a great conversation and sharing your stories and insights on soccer and leadership. Before we close, if there is one message you hope listeners take away, what would it be?
Well, I would say that with any competitive sport or any team endeavor, really look for opportunities to see not only the individual inputs, but the group inputs and how the individual and group inputs synergize. And in the end, and this is really important, how the output of that is usually greater than the sum of the individual parts. And to do that, you usually need some sort of a captain or some sort of a leader that understands that, understands his or her team members, and works towards that dynamic and creates the culture for people to flourish.
I appreciate that so much. You've outlined the role of the leader as to create the whole as greater than the sum of the parts while maximizing the benefits both for each part as well as for the whole.
Yeah. Thank you.
That's what I'm taking away as well. Maya, Pete, Brooke, what are you taking away?
I'm taking away from the whole discussion. When I was nurse manager, the one thing I did was see people so they felt welcome in the environment. And I had a low turnover rate because of it. So it was just remembering little things, or at least picking your head up once in a while and just saying, hey, good morning or good afternoon, wherever time it was. Just seeing them helped a lot.
I think I'm thinking a lot about sort of how people get to be the excellent players that they are, right? The strong team members that they are, and what that says about building knowledge, building skill over time, kind of always working at part of that, and then also paying attention to how you fit within the rest of your team. Right? So, like the individual work and the group work that has to happen synchronously.
Agreed.
Yeah, mine's kind of similar to that. I'm definitely thinking about the persistence that you were talking about and how important it is to just keep going for yourself, and then in that same regard, how that plays into the team and the ultimate goal overall of the team.
Gonzalo, thank you again so much.
Excellent.
And listeners, we'd love to hear from all of you. What is a lesson from sports or play that has shaped how you work and lead? Thanks for tuning in. Until next time, take care and keep learning and leading.
Thank you for listening to our show. Learning to Lead is a collaboration of faculty and students from the schools of medicine, nursing, and health sciences at Quinnipiac University. Creators of the show are Rahul Anand, Maya Doyle, Peter Longley, and Brooklyn Weber. The student producer is Krishna Anand. Senior producer is Brooklyn Weber. And executive producer is Rahul Anand. Connect with us on social media at Learning to Lead Pod, or email us at learningtoleadpod@quinnipiac.edu.